Did you know that in India, as far as the adult population is concerned, there's a huge number, I think north of 35-40% of people who are suffering from fatty liver diseases, specifically in the urban population. Hi, I am Dr. Manaan Gandhi from Dr. Gandhi's Ayurveda clinic, and today we're going to discuss about the liver.
What are the causes of fatty liver?
Fatty liver is nothing but a fatty infiltration of liver. So whenever either when your weight goes a little high, or if you've been having either alcohol or things that are very sour, spicy, fermented, heaty, they can definitely affect your liver. Fatty liver by itself is actually not a disease. It's merely a structural change in the liver, but if the liver continues to be functionally correct, there is no problem. So fatty liver may not need treatment per se, however it is healthier to not have fatty liver.
How liver functions?
In Ayurveda, liver is responsible for manufacturing blood through the red bone marrow. So in a sense, you could probably see that the liver is like the supervisor in a factory, and the workers are the red bone marrow, and the product is blood, red blood. In Ayurveda, blood is responsible for enthusiasm, for spunk, spark, zest, zeal. It gives you that energy. We always say, young blood, warm blooded, hot blooded. We use these terms unknowingly, but blood is responsible for that enthusiasm. So, whenever the liver gets affected, the blood is not produced of a very high quality. Similarly, if the supervisor is missing in action for a long time, that factory is not really going to produce good quality stuff. Once the blood gets affected, you start losing the enthusiasm. You start losing the spark, the spunk, the zest, the zeal, the passion. And the opposite of all of this is depression. So you have a lot of people, and especially youngsters, who've started to feel much more depressed, started to feel much more anxious, who are not sure of themselves, they're not sure of things, they're feeling a little low. And this could definitely be because the liver is affected. Why is the liver affected so much? Is because, again, as I said, liver gets affected by sour, spicy, fermented and heaty food. Most of the outside food that you get today is nothing but a base on which a lot of masala is added. And these masalas, these spices, this much sour, this tasty food is what damages the liver when taken beyond a certain threshold that your body can withstand. Which is why it's very, very important to maintain liver health.
How can Ayurveda helps in fatty liver?
Once the liver becomes fibrosed, there is nothing that you can do that will regenerate those liver cells. However, where Ayurveda comes into the picture is Ayurveda will increase the function and normalize the functions of the cells that are left to try to compensate for the cells that have been damaged. So what you're doing with Ayurveda is you're increasing the function of the liver so that there is no problem in the body, because the problem with the body is if the liver cannot function as well as it should have.
Which treatment we can do in this according to Ayurveda?
So there are a lot of treatments you can actually do in Ayurveda. One of the most famous ones are using herbs like Giloy. You could also use Chirayata. You could also use something known as Katuki or Kadu that we call in Gujarati. All of these herbs, very, very, very potent, very good, and we've seen people with really major liver diseases quickly revert back using these herbs. In fact, allopathy really has nothing for the liver, but Ayurveda does. And a lot of medicines in Ayurveda have come into prominence owing to just the amount of results they've been showing on the liver.
Is there any Panchakarma treatment for this?
When the liver is affected, Pitta normally gets affected. And the best Panchakarma treatment for Pitta is Virechan. Virechan is this huge detox that you've been looking for, wherein you remove things through loose motions. And that you'll actually find, not only does it cleanse the liver, you will actually see bile coming out at the end of Virechan. It's a complicated process. It takes quite a few days, and it is merely to be done with an Ayurvedic doctor, not through a naturopath or through any other allied practitioner, because this requires medical supervision.
How much time this treatment can take?
The Virechan treatment normally can last somewhere between 12 to 21 days, including the diet that you have to follow as well, and needs to be done in a well-equipped Panchakarma center.
Can Ayurvedic treatment be combined with allopathy?
Ayurvedic treatment can actually also be given with allopathic treatment safely. However, there are certain herbs in allopathy that actively cause damage while giving you relief. So if you were to imagine it in a way, is that if you take a right, you're going towards relief, but if you take a left, you're going towards a cure. What you have to decide as a patient is, do you want instant relief so that your next day goes better, or do you want a cure so that your life goes better? Sometimes you have to choose. Other times they may go hand in hand. Allopathy is so symptomatic because allopathy only looks at the how, it never looks at the why. So if you ask an allopathic doctor that, listen, why am I not getting sleep? He will tell you that, listen, your melatonin is not being produced. Here, take a melatonin tablet. But that was the how. That was the process. That wasn't the cause. In Ayurveda, we look at the cause, which is why melatonin tablets are not the solution. If they were, then the minute you stop taking melatonin, you're back to square one. We find out the root cause of the problem. That, okay, बीवी घर छोड़ के चली गई. So now we know what the issue is, and based on that, we need to work on the mind a little bit better rather than give a quick fix solution. So in a lot of times, relief and cure may not be going in the same direction. They may even be opposite. I would always advise going for cure, although if it's very severe, then allopathy can help in relief. There are multiple stages of fatty liver. So there's stage 1 fatty liver, there's grade 2 fatty liver, there's grade 3, and eventually there is cirrhosis. If you have grade 1 fatty liver, you really don't have much to worry about. However, you need to actively prevent it from progressing further. But if you have a higher stage, then you really need to act fast. You need to get your liver better. Regular exercises can help doing this. Cutting out weight can help doing this. So try and get fitter, try and get better, try and support your liver, and under no circumstance is alcohol healthy. So in conclusion, liver diseases can cause depression, can cause anxiety, can cause psychiatric problems. It can also cause your blood to be affected, leading to various skin diseases. Liver problems are caused by things that are sour, spicy, fermented, heaty, but they can also be caused by sleeping late. So try to sleep on time. Try and avoid all of these things. Have them only a little bit occasionally if you have to. And consult an Ayurvedic doctor near you, preferably a person who does Nadi Pariksha, so they can actively diagnose your problem better and use herbs that will be much more effective. This is Dr. Manaan Gandhi. If you like such kind of contents, please support us by pressing the like button. If you would like to share anything or would like to reach out to us, please write a comment. If you like to see more videos like this, press the subscribe button. This is Dr. Manaan Gandhi signing off. Namaste.